As a healthcare assistant in the UK or anywhere else in the world or in the diaspora, there's so many things that you can personally do to enhance your skills, to enhance your competences. And these are things, if you do them and if you do them right and you enjoy them, can actually be beneficial going forward for promotion, for competence, and for career progression as a whole, and for fulfillment and satisfaction in the job as well. Especially when you know what you're doing and you love what you're doing. Trust me, it's more rewarding and fulfilling. What are we talking about today? Today we're going to talk about certain skills or certain trainings that if you do as a healthcare assistant can actually help you in career progression, help you get promoted at work, and also help you to improve your competences in the workplace. Guys, I'm just going to give you a rundown of a few courses that I do feel these are not, I'm not saying they're limited to these, but these are some of them that I do feel if you do them, they can actually help you even as you look for a switch, or even if you look to join certain organizations. Because I know I do get a lot of DMs and emails and texts to say, Flo, I'm wanting to go into the NHS, I'm wanting to move and do support work, or I want to move from domiciliary to a care home, or vice versa. So there are certain things that, I mean, if you've been in the UK for longer, or if you've been in the diaspora for longer, that are expected of you to say, okay, I've got 1 year experience in the UK, and these are some of the courses or the competencies that I do have. It's expected of you, if you have been in the country for longer, to at least have shown a bit of interest in personal development, career progression and learning. Some of these courses that I'm going to mention, or some of these trainings that I'm going to mention, are done online, but some of them are done face to face. So depending on which organization you work for, some organizations do offer these courses and some organizations do not. You have to find an external provider. So a big welcome to my YouTube channel. My name is Florence. If you're watching me for the first time, I am an enthusiast in career progression in healthcare, because I moved to the UK 2 years ago on a healthcare and worker visa, on a skilled worker visa to the UK, and I'm enjoying it. I've moved jobs along the way. I've done quite a few trainings myself, and I've actually seen the benefits. So if you are that person who is saying, well, what can I do? Stay tuned. And if you haven't subscribed yet, please do hit the subscribe button. And for those of you that have subscribed, thank you. So we'll get straight into it. The first thing I want to talk about is the care certificate. More or less in the UK, this has become mandatory for new healthcare assistants, for you to do like the 15 standards of care. Why is this important? This is a set of 15 standards that can cover fundamental skills that are needed for working in health and social care. So it's essential that if you're new in the industry, you could be not so new, but if you're new to the country, definitely there's some things that you need to learn. There's so many things that you can learn about the system here in the UK versus what we used to do back home. So some of the topics that are covered there are communication, infection control, safeguarding, nutrition, confidentiality, information handling, and personal care as well. So there's so much in that respect. Dignity, there's so much that you can learn in there. So it's quite important that in your first 3 months in this country, your first 6 months in this country, your first year in this country, please do make sure, if you're in this industry, health and social care, make sure you've done your care certificate, and you can learn a lot, and you can avoid all those mistakes that we do talk about, all those hearings and mishappenings that do happen in the job when you do your care certificate. So it's important that we do this one. The other course that I want to mention as well is like doing your NVQ. If you're that person who's wanting to pursue health and social care as a career and progress into it like that, it's important that you then progress from your care certificate and you begin to do your NVQs. Trust me, it's a way of upskilling and upgrading. I think I did a video where I said, how can you become registered manager here, registered care manager, be it in a care home, be it in domiciliary or in support work. So that's the pathway that you can actually take, whereby you pursue your NVQs. So the qualification would demonstrate your ability to work in a healthcare environment and also offer you like that leadership experience that you may need to become a care coordinator or a supervisor in a care role. So Level 3 and other are more advanced, are beneficial if you're looking into taking more responsibility and also specializing. You could specialize in dealing with maybe young adults or children. You could be wanting to specialize in dealing with supporting maybe clients or people with specialized needs. So you could specialize in one particular thing. You could just be specializing maybe in mental health, and or specialize in elderly care or children, to be specific. So it depends. There's so much that you can explore along those lines. Also, one of the courses of the trainings that I would encourage people to do is make sure you've done your basic life support. I mean, we do work with people, right? So anything could happen, an emergency could happen. How then can you save a life? How then can you resuscitate them? So basic life support is one of the courses of the trainings that I do encourage people to do, and also to keep on top of it, because I know this one is a course that you have to continuously be doing, continuously renew after every maybe 3 years, depending on your organization as well. So you need this one definitely. You could save a life. So what's involved? The knowledge that you would gain is how to perform CPR, hand or choke line, provide emergency care that can be life-saving in medical settings. Also, how to operate an automatic defibrillator, AEDs, and handling medical emergencies like a seizure or a heart attack. I mean, until I came to the country, I had not seen a defibrillator, an automatic defibrillator. So this is, these are some of the things that you can learn. If you're somebody who is enthusiastic about learning, please do one of these. It's quite beneficial. I mean, especially when you do want to join organizations, it's one of the things that they expect you to know. Can you perform CPR? Do you know how to attend to somebody who is choking or who has had a seizure or a heart attack? How do you respond to that? It's actually one of the questions that you could be asked in a job interview, to say you find somebody lying on the floor. What is it that you can do? So it's important that we actually do some of these trainings. Also, one of the things that I encourage people to do is make sure you've done your moving and handling of people, manual handling training. Why this is important is because we deal with people. Some of them are frail. Some of them need repositioning every now and then. And obviously, it's for their benefit and for your benefit as well. You don't want to end up with a bad back, or you don't want to end up with some ailments, bad shoulder or bad arm, because you've been doing things the wrong way, or you don't want to end up putting the people that you look after in danger. So it's very, very critical, especially when what you do involves personal care or moving and handling as well. So also, part and parcel of the training that you can find when you do your moving and handling is how to operate things like hoists, things like Sarah Steady, how to mobilize, and it's more of safety for the people that you look after and safety for yourself as well. Also, one of the things that I encourage people to do is to do your training in safeguarding of maybe vulnerable adults and children, depending on your work setting, is very, very important, because we do deal with people with different vulnerabilities, people that cannot make decisions on their own, people that can make decisions that can actually see them in danger. So why is it important for one to do their safeguarding training? It's actually mandatory when you're looking after children or the elderly, also so that you can avoid situations where patients or clients are getting abused or neglected, because this is a serious offense in this country that could land somebody in jail, that can actually land people maybe in the coroner's court or somewhere else in the event that this is extreme. So it's very, very important that you attend these courses, or you do these courses, so that you can be able to identify abuse, you can be able to identify neglect, and also how to react and how to deal with them. You can actually note the signs of abuse, the procedure for reporting any concerns or any legal obligations as a responsible citizen, as a person with duty of care. So it's very, very important. Also, part and parcel of the things that I encourage people to do is medical awareness. Guys, I think I did a video where I mentioned something about one big medication error I made when I started off, and thank God I was working for a very, very good organization that said, you know what, Flo, you need to do your training. You need to go for training whereby you're retrained on what to do in the event that somebody requests this and this. And it was handled in a way that I actually realized, like, okay, there was a gap in my training. There was a gap, a knowledge gap. So if you are working, be it in domiciliary, be it in a care home or wherever, I mean, it's very, very important that you do your medication awareness so that you know what to do, you know what not to do as well. So part and parcel of what you can learn, in as much as sometimes you can say, I'm not a nurse, I don't administer, but it's important for you to be aware, because I mean, the medication can be administered and then you are left with that patient, or maybe you're now doing whatever you're doing with them. You should be able to note the side effects of any medication whatsoever that could be given. Also, just supervising also, because sometimes it's not medication like pills and everything, but it could be like somebody takes an inhaler. How do you supervise them? How do you encourage them to do so religiously? Anyway, because it's for their benefit at the end of the day. And you could be in a domiciliary care setting where you are required to prompt medication. So it's very, very important that you're aware of the do's and don'ts of medication, documentation, and things like that. If you want to go the extra mile, there are courses like dementia awareness. If you're that person who is working with the elderly with dementia, then you need that so that you know and understand the behavior. You know how to react to certain behaviors, certain triggers, and you know how to manage challenging behavior, because it can be strenuous on you as a worker, as a support worker. And when you know so much about a condition, when you have been taught how to react, how to manage, then you're not on the edge, you're not stressed out, you're not near burning out. You know how to react and how to manage that, and it's good for you. It's you, because sometimes how you react to certain conditions, especially when you do not know, can look like you're shouting or can end up like as a form of abuse, to be fair. So you need to be aware of certain behaviors, certain triggers, and how to respond accordingly to them. So it's very, very important. Also, there are courses like end of life and palliative care. Part and parcel of what we do in care, especially if you're looking after the elderly, the frail, the vulnerable. Definitely, end of life is inevitable sometimes, it's unavoidable sometimes. So you would need to take up this course. If you're in that situation, it's very, very important, especially if you're working in settings like nursing homes, hospital, or end of life, in a hospice. You know, it's very critical. Or you could be in support work, but you're looking after somebody who is on an end of life pathway. It's very, very important. So some of the things that you learn there is how to offer emotional support to families and the patient themselves. Also, how to manage pain is very, very important. The symptoms and control communication around end of life issues, and also how to escalate or how to relate. I mean, I've learned a lot looking after the elderly, working in an elderly ward, looking after people on an end of life pathway. Sometimes things like mouth care and things. Those are things that you learn when you decide to do a palliative care course. So it's very, very important. And I mean, if you're going to look for a job in a hospice setup or in a nursing home, then definitely it could be an added advantage if you've actually done that course. Also, one of the things that I want to talk about is food hygiene and nutrition is very, very important. Nutrition, hygiene, hydration is very, very important, so that you understand the importance of a good diet, the importance of keeping the patient hydrated for the sake of their health, for the sake of everything else good. So it's very, very important. Also, hygiene at the end of the day. So because we look after vulnerable people, so how hygienic we are around food, around them, is very, very key for their good well-being. Some of the trainings also that I key and specialize are trainings like phlebotomy training. This is important to learn how to take blood samples, and also this can actually open up additional opportunities for you as a healthcare assistant. To be honest, phlebotomy trained healthcare assistants are in high demand in this country. And obviously, when you have done that training, you actually I think healthcares will do that job in band 3, band 4, because it's quite specialized. So some of the techniques that you learn are blood collection techniques, handling and labeling, and also patient interaction during the procedure. So it's a specialized technique. It's a technique that you have to master. And I mean, go for it. If you do feel it's for you, please do go for it. Also, depending on the setting that you work in, I would encourage other people, if you want, you could do autism awareness. Yeah, it's very, very important if you're going to be working with children, or individuals, young adults on a spectrum. It's very, very important that you understand their condition, you understand their triggers, you understand their behavior, and also how to care for them. It's quite important. I cannot overemphasize the need for basic IT skills, guys. Until I joined the NHS, I didn't realize like how important it is for somebody to have good IT skills, to be able to type very fast. I still am not yet there, but I'm learning along the way. I've always said, well, I don't need a computer, I don't need this, I don't need to learn computer skills, but you never know when you need them. So we are living in that age where, I mean, technology, you cannot avoid it, you cannot run away from it. So it's important to start learning typing skills, fast typing, documentation, Word, spreadsheet, and things like that. It's very, very important because it's here. Guys, I cannot overemphasize other specialized training like catheter care, wound care. It's very, very important. Health and safety, risk assessment, fire safety, hazardous and material handling. These are courses that can lead into a specialized career path from where you are at. So I cannot really overemphasize the fact that there are certain skills that you need, certain trainings that you need if you want to grow and progress, if you want also to increase your chances of getting a job, if you're transitioning from whatever that you're doing and you want to go for another job. Training is very, very important. Also, I want to say, for career progression's sake, to be honest, you could be wanting to move into being a senior carer, a team leader, a care coordinator, or even transitioning into nursing or social work or other things. So it's very, very important that you prioritize training. You prioritize getting your competencies up to date. And also, I want to mention something before I end this, to say, when you do specialize in areas like mental health, dementia care, phlebotomy, you also find that you get yourself into opportunities that are high paying. I've said people that are in phlebotomy or dentistry or mental health actually are band 3s, band 4s, which is better than, I mean, I'm a band 2, I'm just an ordinary healthcare assistant. So with specialized training, you can actually then start aiming for those higher band roles. Also, last but not least, I would say it's very, very important for one to, prioritize personal development, training, because it's a confidence and competence booster. When you gain more knowledge and practice skills, you feel more confident in handling different patients, their needs and situations, and also, contributing to the overall care that you give as a team, as a ward, or as a care setting. So, guys, that's all I had for you. And until next time, bye.